Brett King, and I am a dermatologist in Connecticut and the USA, and it is a sincere pleasure to be here today. I delivered a late breaker yesterday, and that was regarding a work in vitiligo, a IL-15 antibody called ordesekimab in the care of patients with vitiligo. In that clinical trial, it was very interesting to see that with 10 weeks of every other week injection of ordesekimab, that we were able to, between weeks 24 and 48, during which time patients were being treated with phototherapy, that we were able to see a real change in their vitiligo that we had not seen in the first 24 weeks of 10 weeks of treatment, followed by 14 weeks of monitoring. And for me, this work is really important to us because I think it highlights the role of not only the potential role of IL-15 antibody treatment of, or IL-15 inhibitor treatment of vitiligo, but it really highlights, I think, the very important role of combination therapy. We need for the treatment of vitiligo to suppress inflammation. We also need a stimulus of melanogenesis, which I think is best achieved with narrowband UVB phototherapy. So that was, I would say, maybe one of the highlights for me. In alopecia areata, I loved the work presented, sort of updates the work of upadacitinib in alopecia areata. Truly, every few months at a different meeting, there's new data. I think in the next 6 or 9 or 12 months, that's going to continue to be true. More and more data for this other JAK inhibitor for the care of our patients with severe alopecia areata. I was super excited at the meeting to see that 80% of adolescents treated with upadacitinib are effectively growing hair. That is when those patients are starting with hair, so adolescent patients with a baseline SALT score of 50 to 94, but it also works really well in patients with a baseline SALT score of 95 to 100. This for me was truly one of the highlights of data presentations here. Another highlight was the rezpegaldesleukin late breaker presented by David Rosmarin in alopecia areata. In that work, we have over 36 weeks of treatment with this IL-2 molecule that 16% of patients are achieving a SALT score less than or equal to 20. In case you say 16%, that's nowhere near a JAK inhibitor. Absolutely, that's true. But this is the point. It's not a JAK inhibitor. We need a non-JAK inhibitor for the care of our patients with alopecia areata. And so for me, it's really exciting to see something emerging that has promise. I look forward to future data presentations of rezpegaldesleukin in alopecia areata and also another molecule called bempikibart for alopecia areata. These are things that I think we should have excitement about at this moment in time. And then maybe 2 more things. The data for baricitinib in adolescents. We all have familiarity with baricitinib treatment of severe alopecia areata in adults. Well, here at the meeting, we saw what that efficacy of baricitinib looks like in patients between the ages of 12 and 17. It's almost upadacitinib-like. We're seeing numbers up around 70% of adolescents who start with a baseline SALT score of 50 to 94, regrowing hair over 36 weeks of treatment. We have not seen results like this with another JAK inhibitor before. And so that is really cause for celebration in dermatology. Then the last bit of excitement I have in the alopecia areata space is emerging data, not necessarily, I presented some here, but it's data from the literature in the last 6 months. And it's data showing that if you have a patient with alopecia areata who you've treated for 6 months or 9 months and they're not growing hair, we now have a growing body of evidence that says, try another one. Try a different JAK inhibitor. First, we must give every JAK inhibitor 6 to 9 months before we make this decision to switch. But we now have a lot of data emerging saying failure of one JAK inhibitor does not mean that another JAK inhibitor will not work. And so an important kind of teaching point for all of us. And so with that, thank you so much. It's really been a dynamic, exciting meeting, and we have so much to celebrate. We have so much to come to celebrate. And so thank you so much for this opportunity.